Ebola. This virus comes from contact with infected blood or animals like bats and monkeys. It's like a fire alarm that also cuts the phone line, since it disables your defenses while it attacks. Within 2 to 3 weeks, fever and tiredness show up, looking a lot like the flu at first. Then it turns serious. Blood vessels get attacked, causing bleeding inside and outside the body, and organs start shutting down. Past outbreaks have killed more than half the people infected. A vaccine now exists for the most common strain, influenza. The flu travels through the air whenever someone coughs or sneezes nearby. Symptoms hit fast, usually within a day or two, bringing sudden fever, chills, and deep body aches. Most of that misery is actually your own immune system fighting back, not the virus itself. A week later, most people feel fine again. But every year, this constantly changing virus still kills hundreds of thousands of people, worldwide, mostly the very young, the elderly, and people with weak immune systems. Rabies. You catch this from the saliva of an infected animal, almost always through a bite. It travels slowly along your nerves, heading straight for your brain. That trip can take weeks or even months. Early on, there's fever and a strange tingling right where the bite happened. Once the virus reaches the brain, confusion and hallucinations set in, along with a terrifying fear of water caused by painful throat spasms. By that point, death is almost certain within days. A series of vaccine shots given soon after a bite is the only thing that can stop it in time. HPV. This is the most common infection spread through sexual contact, passed skin to skin. Most of the time, it's a quiet guest who lets itself out within a year or two. Most infections cause zero symptoms and clear up on their own. But a handful of higher-risk versions overstay their welcome, slowly changing cells over many years in ways that can eventually turn into cancer of the cervix or throat. Other versions just cause visible warts instead. A vaccine now blocks the versions responsible for almost all HPV-related cancers. COVID-19. This one spreads through the air, mostly from breathing near an infected person. It's like a key that fits locks all over the body, not just the lungs, which is why symptoms can show up almost anywhere. Within a couple weeks of exposure, fever, coughing, and tiredness usually appear, and many people lost their sense of taste or smell in the earlier versions of the virus. Some people barely notice they're sick. Others develop severe lung inflammation needing hospital oxygen. A portion of survivors deal with lingering fatigue and brain fog for months afterward, something doctors now call long COVID. Vaccines built in record time cut the worst outcomes dramatically. Dengue. Certain mosquitoes carry this one, especially in warm, tropical places. Oddly, your body's defenses from round 1 can help a different strain break in faster on round 2. About a week after the bite, high fever and pain so intense it earned the nickname breakbone fever, come on fast. Most people recover with rest and fluids, but a smaller group develops severe dengue with leaking blood vessels and dangerous bleeding, and that's more likely on that dangerous second round. Cases are rising as warmer weather lets these mosquitoes spread further. HIV. This virus spreads through infected blood, semen, or other body fluids. It doesn't attack everything at once. It infects the immune cells meant to run your body's defense. Flu-like symptoms can appear within weeks, though plenty of people notice nothing at all. Left untreated, it quietly weakens the immune system for years until, eventually, the body can no longer fight off infections it would normally shrug off easily, a stage called AIDS. Daily medication today can push the virus down to undetectable levels, letting people live long, healthy lives, even though a full cure still doesn't exist. Chickenpox. This spreads through the air and through contact with the fluid inside its blisters. An itchy rash covered in fluid-filled blisters shows up a couple weeks after exposure, and it's contagious until every single blister has scabbed over. Most kids bounce back within 2 weeks. But the virus never truly leaves. It hides quietly in nerve tissue and can reappear decades later as shingles. A vaccine has made severe cases in children much less common today. Marburg virus. Close relative of Ebola, this one also comes from fruit bats and spreads through infected body fluids. It's Ebola's cousin, and sometimes even deadlier. High fever and exhaustion appear within a couple of weeks, and it quickly progresses into serious bleeding and liver damage. Death rates in past outbreaks have ranged from about 1 in 5 to as high as 4 in 5 people infected. There's no vaccine yet, so doctors can only treat the symptoms while the body tries to fight it off alone. Common cold. Over 200 different viruses. can cause this, though rhinovirus is usually the main culprit, and it spreads through the air and dirty surfaces. A scratchy throat starts within a couple days, followed by sneezing and a stuffy nose. Much of that misery is really your own immune system working to flush the intruder out, usually peaking around day 3 before fading over a week or so. With so many different culprits, a single vaccine just isn't realistic. Zika virus. Mosquitoes spread this one too, and it can also pass through sex. For most people, it's barely noticeable. Up to 80% never show a single symptom. The real danger only shows up when it rains on a house still under construction, meaning a pregnancy. Infection during pregnancy has been linked to microcephaly, a serious condition where a baby's brain and skull don't develop fully. That connection turned a mostly forgettable virus into a worldwide scare back in 2015. No vaccine exists, so avoiding mosquito bites is still the best protection during pregnancy. Hepatitis C, spread through infected blood, once mostly through transfusions, and now mainly through shared needles. This virus settles quietly into the liver. It works quietly, wearing the liver down so slowly that years can pass unnoticed. Left alone, it can eventually scar the liver so badly it stops working properly, and it raises the risk of liver cancer too. The good news is huge. Modern medication now cures more than 95% of cases in just weeks, a massive leap from the difficult treatments doctors relied on in the past. Measles, extremely contagious, spread through the air, and able to linger in a room for hours after someone leaves. High fever and a blotchy red rash appear within a week or two of exposure. Complications can include pneumonia and dangerous brain swelling, and in rare cases, a fatal brain disease can appear years after someone seems fully recovered. Strangely, measles can also wipe out your immune system's memory of past infections you'd already beaten. A vaccine has existed for decades, though falling vaccination rates have let outbreaks return in places that once eliminated it entirely. Nipah virus. This one jumps from fruit bats to humans, sometimes through pigs first, and spreads through contaminated food or close contact. Fever and muscle pain start within a couple weeks, quickly turning into confusion and extreme drowsiness. Severe brain swelling and coma can follow, and fatality rates have ranged from roughly 40 to 75% depending on the outbreak. There's no vaccine, only supportive care, but because it doesn't spread easily between people, outbreaks have mostly stayed contained to parts of Asia so far. Norovirus. This spreads through contaminated food, water, and surfaces, and it takes almost nothing, just a tiny amount, to make someone sick. Sudden vomiting and diarrhea hit within a day or two of exposure, usually clearing up within a few days. The real risk is dehydration, especially for kids and older adults. It's tough to kill too, surviving on surfaces for days and shrugging off many hand sanitizers, which is exactly why it spreads so fast through cruise ships and schools. SARS. This coronavirus first appeared in 2002, spreading through the air and triggering an unusually aggressive immune response. What stopped it wasn't medicine. It was strict lockdowns and isolation. Fever and body aches came on within a week, often progressing into severe pneumonia, with about 1 in 10 infected people dying. Strict isolation and contact tracing shut the outbreak down within about 8 months. No case of this original virus has been seen anywhere in the world since 2004. Polio, spread through contaminated water, entering the body through the mouth. Most of the time, it stays in the intestines and causes little illness. But every so often, in roughly 1 out of every 200 cases, it breaks into the control room instead, the nervous system, attacking the nerves that control muscles and causing permanent paralysis, sometimes even affecting the muscles needed to breathe. There's no cure once that happens. A vaccine introduced in the 1950s slashed global cases by more than 99%, bringing the world close to wiping polio out completely. West Nile virus. Spread by mosquito bites, this virus arrived in the Americas in 1999 and quietly became a permanent seasonal visitor. For about 80% of people, there are no symptoms at all. In the rest, fever and body aches show up within a couple weeks. In under 1% of cases, the virus crosses into the brain, causing dangerous swelling that's especially risky for older adults. There's no vaccine for people, so avoiding bites with repellent remains the main defense. Herpes simplex virus. Spread through skin contact, sometimes even when no sore is visible. This virus comes in 2 main types, generally tied to the mouth or the genitals. A first outbreak can bring painful blisters, though plenty of people never notice they've caught it at all. Sores heal within 1 to 2 weeks before the virus retreats and waits, sometimes triggered later by stress or illness. There's no cure, but medication can shorten flare-ups and make them less frequent. MERS. Another coronavirus, first spotted in 2012, catching mostly from infected camels and only occasionally spreading person to person. Fever and trouble breathing appear within about 2 weeks, and severe cases can rapidly turn into pneumonia and respiratory failure, with roughly 1 in 3 confirmed cases proving fatal, a far higher rate than COVID-19. Its limited ability to spread between people has kept it from becoming a global pandemic. No vaccine exists yet. Rotavirus. This virus spreads through the fecal-oral route, usually via dirty hands and surfaces, and historically caused massive numbers of severe childhood illness. It seems minor, but a small child's body has very little room for error. Vomiting and watery diarrhea start within just a couple days, lasting up to a week. Dehydration remains genuinely dangerous, especially where medical care is hard to reach. A vaccine introduced in the early 2000s has cut hospitalizations and deaths dramatically around the world. Yellow fever. Spread by mosquito bites across parts of Africa and South America, it's named for the yellow tinge, jaundice, it can leave behind. Sudden fever and severe headache appear within about a week. Most people recover there, but roughly 15% of cases take a darker turn, developing jaundice, bleeding, and organ failure, with as many as half of those patients dying. A single-shot vaccine from the 1930s gives lifelong protection and is still required for travel into many countries where the disease remains common. Mumps. Best known for the puffy, swollen cheeks it causes, spread through saliva and respiratory droplets. Fever comes first, followed by that telltale swelling, making chewing and talking uncomfortable for about a week. Rare complications can affect the ovaries, testicles, or even the brain, and before vaccines existed, mumps was a leading cause of hearing loss acquired in childhood. A combined vaccine introduced in the 1960s has made large outbreaks rare today. Hantavirus, caught by breathing in dust contaminated with droppings or urine from infected rodents, particularly deer mice. It's like dust that seems harmless until you actually breathe it in. Flu-like symptoms can take anywhere from 1 to 8 weeks to appear, which makes it tricky to trace back to its source. It can then progress shockingly fast, sometimes within a single day, filling the lungs with fluid, and even with intensive care, close to 4 in 10 people with this severe form don't survive. Since it doesn't spread between people, staying away from rodent droppings is the entire defense. Hepatitis B. This blood-borne virus infects hundreds of millions of people worldwide, often passed from mother to child at birth. Fatigue and jaundice can appear in adults, though infected infants often show nothing at all. The real threat, if caught early in life, is chronic infection, which quietly damages the liver over decades and raises the risk of cirrhosis or liver cancer. A vaccine from the 1980s is now given to newborns within days of birth, specifically to break that chain of passing it down. RSV, so common that almost every child catches it by age 2, spread through the air. For toddlers, it's usually just a cold they shrug off within a couple weeks. But at the extremes of age, in newborns and older adults, this same virus can hit far harder, sometimes triggering pneumonia or serious breathing trouble that lands someone in the hospital, making it one of the leading causes of infant hospital stays worldwide. New tools now exist, including a maternal vaccine and a preventive antibody shot for newborns, specifically to protect the most vulnerable months of life. Mpox, a relative of smallpox, spread mainly through close skin contact. It's smallpox's cousin, close enough that the old smallpox vaccine still works. Fever and swollen glands appear before a distinctive rash shows up within 1 to 2 weeks, moving through several stages over the following weeks. Fatality depends heavily on which strain is involved, generally low, but higher for one strain circulating in Central Africa. Vaccines built for smallpox proved effective during the major 2022 outbreak. Rubella, sometimes called German measles, though it's a completely different virus, spread through the air. For most people, it's mild enough that half of all infections go unnoticed. The real danger appears only when a pregnant woman catches it early on, since the virus can cross into a developing baby and cause serious birth defects, including deafness and heart problems. That single risk is exactly why rubella vaccination became a global priority, bundled into a routine childhood shot years before anyone gets pregnant. Hepatitis A. Unlike its liver, related cousins, this virus never sticks around long-term, spread through contaminated food or water. Fatigue, nausea, and jaundice show up within a month or two of exposure, occasionally serious enough to need hospital care in older adults. But it always clears on its own eventually, with no chronic liver damage left behind. A vaccine is now a routine part of many childhood immunization schedules. Shingles. This isn't caught from someone else, it's the chickenpox virus waking back up decades after it first hit away in your nerves. It's like an old account logging back in on its own decades later, uninvited. Pain or tingling in one small area of skin often shows up days before any rash appears. A painful, blistering rash then follows the path of a single nerve, and the pain can linger for months after the rash itself is gone, a condition called post-herpetic neuralgia. About 1 in 3 people will experience it at some point. A vaccine for older adults now sharply lowers both the risk and the severity.